All right. Hi, Betsy. My name's Luis. I'm a social worker here at the hospital. I'm here to talk to you a little bit more about what brought you in. So I know that I called you Betsy. Is there a certain name that you prefer? I personally use he, him pronouns.
Thank you. Betsy is fine. She, her.
Okay. Thank you, Betsy. I know it's like a lot of people coming in and out of your room. So if you have any questions while I talk to you, I want you to let me know that you can ask for whatever you want. Also, Betsy, if I say anything wrong, please let me know as well. Okay?
Okay.
All right. Betsy, I understand that you came in due to alcohol poisoning. I know that the doctor talked to you about this. That's the reason why I'm in here to talk to you a little bit more about what might have caused this to have happened. All right.
Sure. Yeah.
Okay. And then Betsy, the reason I'm here is, like I said, is to really get to the reason why this might have happened. And I want you to know that I talk to a lot of different patients with a lot of different problems. So I want you to be as open and honest about your answers as possible. Because the thing is, I'm really not here to judge. I'm really here to help you understand where this is coming from, to make sure that it doesn't happen again. Because I know that it's something scary to have to come to the hospital for any type of poisoning. Does that make sense?
Yeah. I think we need to figure out how it happened because I feel like I'm careful, and I thought that I had enough to eat. I don't know how it happened.
Okay, perfect. Yeah. So I'm going to ask you questions and pause me at any time, but hopefully we'll be able to get to the root of why this might have happened. So Betsy, about how much would you say that you drink on average?
Well, I get home from work and I feel a little stressed. I need help unwinding. And so I usually get a bottle of wine and, have dinner and kind of chill out with Netflix. And I might not be paying attention to how much I'm drinking, but
Yeah.
before I go to bed, the bottle's gone, I went through it.
Okay. So you're saying that you like maybe on a typical night, you might have a bottle of wine and you'll go through the whole bottle by the time the night's over.
Sometimes, yeah, probably like tonight I was like that.
Okay. And then, Betsy, how often do you drink alcohol, like, or have a drink containing alcohol? Would you say never, like once a month or less, about 2 to 4 times a month, 2 to 3 times a week, or about 4 more times a week?
Probably like 3 to 6 times a week.
Okay. And then, Betsy, you mentioned that you drink wine. Are there any other drinks that you typically consume in those 2 to 6 times a week?
Sometimes I'll meet my friends at the bar and, we'll do shots together and things, kind of like a pre-game party and stuff. But, when I'm by myself, it's mostly just wine.
Okay, because when you'll go with your friends, it's typically at a club, so you'll probably do a couple of shots and stuff like that. And then when you're by yourself, you typically just have like a wine.
Yeah.
Okay, and then Betsy, how often do you have 5 drinks or more? Never, less than monthly, monthly, weekly, or daily, almost every day.
I think it probably used to be weekly, but things have been really, really stressful. And so it's been more often. My boyfriend will come over and he will bring his own. And so even if I wasn't planning on drinking that day, then maybe when we're together, then I will some more.
Okay, Betsy, thank you for sharing that with me. That's helping me understand a little more of where you're coming from. And have you had times where you ended up drinking more or longer than you intended? I know you just kind of described one, but what would you say?
Yeah. Yeah. When he comes over, like I maybe had stuff that I was gonna do that night, but I don't get it done because I'm, too sleepy or buzzed.
Okay. Um, Betsy, have you ever gotten sick before? From drink, like after you had drank a lot?
I mean, like I get headaches and I've I've thrown up a couple times, like tonight, before I came in. Is that what you mean?
Yes. For example, some people never get sick after they drink, right? And some people get sick every time. And some people do sometimes. So I want you to tell me how often after you drink would you say would you that you get feel sick in some type of way?
Probably half the time lately, but it used to only happen like once a month, but yeah.
Okay. Um, uh, Betsy, have you ever wanted a drink so badly that you couldn't think about anything else?
I think I think I've needed a drink to help me think about something else, like if I was really, really stressed and feeling anxious, then I wouldn't be able to do anything until I got help winding down.
Okay, so you're saying that for you, alcohol has kind of been like a way to transition into thinking about something less stressful or a way to deal with your anxiety.
Mhm.
Is that correct?
Yep.
All right. And then let's see, has drinking ever interfered with like taking care of your home, your family, or like caused issues in any of your relationships?
I mean, sometimes my boyfriend fights with me because things aren't as clean as he wants them to be. And I don't know if it's because of my drinking, but yeah, sometimes I get too tired and I needed to unwind. So maybe.
Okay. And then have you found that when you drink, you get into situations that might have been more dangerous than you would have if you weren't?
Yeah. Like when I leave the bar, sometimes my friends will drive me home, but I don't think that any of us should probably have been driving. Thank God nothing's happened yet.
Thank you for telling me that, Betsy. Because I know sometimes it can be scary. And like I said, these questions are meant to help you like reflect and see where things have gone or have been. So Betsy, my next question is, um, have you ever had to drink much more than you used to in order to get the effect you wanted, or found that the number of drinks has less effect?
Yeah, I always thought it was just because maybe I bought too cheap a wine or something, but I have a favorite one that I'm not liking as much anymore. So maybe that's what's happening.
Okay. And then Betsy, have you found that when the effects of alcohol wear off, you've had like withdrawal symptoms, for example, trouble sleeping, shakiness, restlessness?
Yeah, but I feel like that's hard to know if it's because of my drinking or because of my anxiety, because I already feel that way when I'm, trying to go to bed.
And then Betsy, you've mentioned anxiety and stress. Tell me more about that.
So I've had insomnia for years and it just has gotten worse since COVID.
Okay.
And and I think rather than like know how to deal with it, I'm just too tired. And so yeah, I guess wine has become my crutch right now.
Okay. So you said that it's your crutch right now. And at the beginning of when you and I started talking, you mentioned that you weren't sure what was going on. Do you feel that you have a better idea of what's happening now or why this might have happened?
Yeah, I got to figure out how to get this anxiety under control because it's not getting better.
Right. I think that like I don't know you super well quite yet. So I'm thankful for that you were able to open up and talk about some of this stuff. I would say that it seems like you have a lot of stress and anxiety in your life. And as it's gotten worse with things like COVID, you've had to use more coping skills. Alcohol typically is used as a coping skill by many people, but it can lead to these negative effects that brought you into the hospital. So I'm going to recommend some different things that help you manage your stress that doesn't use alcohol as a crutch, as you had mentioned. Something else before we talk more about those interventions, I want to mention is it's often a misconception that eating enough before you start drinking will make it have less negative effects, and that's actually not true.
Hmm,
All it does is it stops you from getting drunk immediately, but those negative effects still happen.
I
Okay.
didn't know that. Okay,
All right. So I'm going to go ahead and check in with the doctor, and then I'll be back to talk to you about some of those interventions. Do you have any
thank you.
questions, Betsy?
I don't think so.
All right. Thank you so much.
Thank you.
Okay.
Brilliant.
Thank you. I'll go ahead and switch.
Hey, hi, Sam. My name's Crystal. I'm a social worker here at the hospital. I use she, her pronouns. Is there any name you would prefer?
No, I use Sam and I use they, them pronouns.
Thank you. All right, so I understand that you've come to us today because of an accident in the past that's been giving you a lot of neck and back pain, and that you don't think that you've had enough hydrocodone from the doctor. Is that true?
Yeah, the thing is that I feel like I'm constantly in pain, and I've had to like use my own, like, I guess, resources to try to deal with it when I feel like the doctor could easily just give me more medication.
I
And I
see.
don't understand why it's such a big deal.
Okay, so you feel like you are in pain that requires medication and the doctor hasn't been giving you enough, and so you're finding other ways to get the medication that you feel you need. Is that true?
Yeah.
Okay, thank you. So I'm going to try and ask some questions to help us get a bigger picture of what's happening so that we can work with the doctor and determine what is needed. And I'm going to just have you give me a rating scale. So we're going to use never, seldom, sometimes, often, or very often. Does that sound like a scale you can remember, or should we switch to numbers?
I actually think numbers would be easier for me.
Okay, that's fine. So let's say that never is zero,
Okay.
seldom is one, sometimes two. So that's like in the middle. Often is three, and very often is four. Does that work better?
Yeah.
Awesome. Okay. So in the past 30 days, how often have you had to go to someone other than your prescribing physician to get your sufficient relief from medication?
Probably like a 3 or 4. Well,
Okay.
actually, I don't know why I said that. It's a 4 because I do have to go to someone else to get enough medication.
Thank you. Okay. So in the past 30 days, how often do you complain that you're not completing necessary tasks, like being able to get things done that you need to do or get to class or work or appointments?
How much like am I not able to do it, or how much I complain about it?
Um, let's ask the question of just complaining that it's, getting in the way. You're not feeling like you're able to get as much done.
Probably like a 4
Okay, thank you.
because like it's so, I don't know, like I'm in a lot of pain. And so I complain enough that I have to use more of my medication.
That makes sense. And it sounds really hard to be hurting so much, to have it interfering with your life like it is. I'm glad you're here to talk to us about it today. In the past 30 days, how often have you taken your medication differently from how the doctor has prescribed it?
Yeah, it's a 4 too.
Okay.
I take at least 2 a day.
Mhm.
Where he had recommended me 1, which isn't enough. Have had this problem since I was 25, and so
Okay.
to me it makes sense that the same thing wouldn't be sufficient enough, but they haven't changed my prescription.
I understand. And figuring out the safe amounts and being able to manage the pain, it's going to take an individualized plan. And it's also something that we need to pay attention to figure out why the doctor prescribes it at the amount that he does and what other things he would recommend, and that we can work together, because I don't want you to be in pain. I understand that this is really frustrating, and you've been dealing with it for a really long time. In the past 30 days, how often have you seriously thought about hurting yourself? Is this something that's been coming up for you? Zero
Probably
to four.
like a 1 or a 0, because I
Okay.
don't. I mean, I might jokingly tell um, my partner like, "Oh, this hurts so bad, I'm gonna kill myself," but I don't mean it. But I feel like because I say that, I probably should at least say like a 1.
Okay. So when you're joking about it, is it coming from a place of frustration or just feeling annoyed?
I'd say frustration. I just feel like it's a way for me to like kind of vent about it.
Okay,
Maybe it's not a good joke, but I feel like it works for me.
I understand. And it doesn't sound like it's something that you feel seriously, that you're not seriously thinking about hurting yourself.
Yeah.
Okay. In the past 30 days, how much time was spent thinking about your opioid medications? Having enough, taking them, dosing?
Um, to be honest, I don't know. I guess that's probably like a 1, 2.
Okay.
Because I don't know. I don't think about it so much now that I'm, I guess, not using it the way that I'm supposed to.
Mhm.
But now that I take it more frequently than I'm prescribed, I don't think about it. But I feel like before I would, I was like, oh, I wish I had one. So now that I take one, I just feel like I don't think about it as much.
Great. That's a helpful distinction. That helps me understand. I appreciate that. All right. So in the last 30 days, how often have you needed to take pain medications belonging to somebody else?
I'm not sure how to answer that because I do get medications that aren't, I guess, prescribed. I don't get medication that are prescribed from the doctor, but they still belong to me.
Okay. So how often would you say you've been taking medications that don't belong to you on 0 to 4? Like from the doctor, you say that they do belong to you from other sources. We're
Yeah.
going to say just separate from the doctor's medications versus something else.
Well,
How
it's like
often?
because half is from the doctor and half is from other sources. So
Mhm.
I'm not sure how to answer that question.
And the other half you're taking every day, once a week.
Oh, I take it every day.
Okay, that's helpful. Thank
It's
you.
like half and half, you know?
Okay. In the past 30 days, how often have you needed to make an emergency phone call or show up at the clinic without an appointment?
Um, I don't think that that's like how often I had to, I would say 0.
Okay. And the last question I'm going to ask is how often in the past 30 days has your pain medication been used for a symptom other than pain, like to help you sleep or improve your mood or relieve your stress?
Um, Probably like a 2 because
Mhm.
I mean, they are for pain, but sometimes it is easy just to take another pill for something else as well. Because it
Great.
seems effective.
I understand. I really appreciate you being so upfront with me today. It's really helpful for me to understand kind of your pattern and what your needs are. And opioids can be really tricky because there can be a reduction in a feeling of effectiveness, and yet that sense and need for relief is still there and sometimes grows. And so I think we're going to take these scores to the doctor and see if we can help him understand where you're coming from. And maybe you and I, when he's finished with you, we can start talking about other ways of managing pain, things that will reduce the level of pain you're having absent of medication. You'll still be on your own prescriptions, but I think it sounds like this is a constant thing for you. And I'd like to be able to see if we can find other solutions in addition. Does that sound like something you'd be interested in?
I mean, we can try. It does make me feel weird having to get medications from like a non-official place. Like it makes me feel like I'm doing something wrong. And so that's why I personally would prefer just to get additional like medication from the doctor. But if like I have to do whatever it is you're saying in order for that to happen, I'm willing to try.
I appreciate your honesty. And I want us to figure out with the doctor's help and your input how to help you feel the safest. I would prefer you not to be using things that aren't from the doctor, right? They're not as monitored. And I think it's best to play it safe. So we want to be able to find somewhere in the middle where you can be safe and to address your pain needs. So thank you, Sam. I will be right back. I'll take this to the doctor.
All right. Thank you.
Thank you.